So let's solve the skin questions. There are 23 skin questions. 58-year lady, lichen sclerosis. Course of action: wide excision, punch biopsy. This needs a punch biopsy. Why? Useful option of full thickness tissue sampling for minimal tissue disruption. The differential rate would be neoplasia, or that's why you have to do skin disease and all that. Next question, this is about skin lesions. That's why blood flow thickness 1 mm is 1 centimeter, 2 mm 2 to 2 centimeter, more than 2 to 4, 2 to 3, more than 4, 3. This is the wide excision. Which of the following statement regarding to sebaceous cyst is false? What is false? Infected ulcerative pancreas typically contains pus is false. It is contains the sebum. 70-year-old lady describes unsightly. On examination, there is raised greasy surface, keratin plugs. So seborrheic keratitis. This is seborrheic keratitis. Greasy surface. Which skin lesion listed below resembles malignant melanoma? What looks like malignant? Spitz nevus or nevus? It sometimes look like a best to excise. Clinical appearance is like few months in children, maybe pink red. Dermatofibroma usually affects extremity, lesion larger than appear. Proliferating fibroma emerging especially. Solitary dermal nodules. 70-year man, basal cell carcinoma in the temple, BCC. Factors outlined bearing greatest bearing on prognosis. Excision, completeness of the excision is important. Thirty-four-year gardener presents affecting dorsum of the hand in last 10 days occurred after having pruning rose bushes. Ulcerated lesion bleeds easily on touch. This is pyogenic. Bleeds to touch. Ulcerated hand, pyogenic granuloma. 8-year boy, swelling supratemporal aspect, painless swelling. Superotemporal aspect of the orbit. Smooth on examination, visual node is falling excision was found to be lined by squamous and hair follicle. Hair follicle means it can be dermoid cyst, pilar cyst, dermoid cyst. (22-year infected sebaceous cyst, discharging pus. Treatment is IND. Incision and drainage. 53-year nodule on the chin, rapidly growing, swollen red dome, center keratinous is keratoacantoma. Rapid growing, keratin pearl, keratoacantoma. Crohn's disease, purple colored skin, ileostomacite, pyogenic gangrenoderm. (65 man present with 5 cm ulceration of the medial malleolus. 65, 5 cm medial malleolus. Complaint that there is non-healing and simple bandage. What is the course of action? This is a venous ulcer. You need a biopsy that because is not healing. That's why punch biopsy is important. Marginal ulcer. 21-year lady, present nodular posterior aspect of the right calf, posterior right calf, 6 month. Although nodule appears small on palpation, it appears to be nearly twice as size on examination. Faintly pigmented. Overlying skin is faintly pigmented. Posterior aspect of the right calf and the sides are faintly pigmented, can be split snus. So okay. Larger than appearance and frequently at the sites of previous trauma. (89-year) seborrheic warts. What is the treatment? Shave, because this is large. (83 lady, pigmented irregular superficial, large on torso, do not bleed, increasingly itchy. Itchy is again treatment, shave biopsy. 30-year, while shaving, corners of the lip. Few days later, lesion appear at the bleed on contact, granuloma. (22-year), right shin, newly pigmented, regular borders and appearing normal appearing appendages. Increase in size. What is best course of? So dermal appendages normal appearing. Excision. What is the excision? Yes. (28-year-old), ileocecal resection, Crohn's, stomach ulcer, pyoderma gangrenous. (72-year), face nodule, friable, no lymphadenopathy. Not resolved with, occasionally lesion has resolved, noted to resolve with scarring. It can be keratoacanthoma, self-resolving. (68) farmer, skin on the forehead, red, slightly in size, ulcerated, purely white, 2 centimeter basal. (29-year), lump in the scalp, 4 centimeter, occipital protuberance, fluctuant, small epithelial defect, centrally located small epithelial defect. So it's dermoid cyst or sebaceous cyst. Cox specular tumor. This 23-year, itchy, pigmented thigh. So punch biopsy. Excision, avoid incision, punch biopsy lesions. Melanoma is there. 22 man, weight loss, skin lesion is small itchy, pemphigus, so dermatofibra herpetiformis, celiac disease. Okay. (28-year female, back exercise for cosmetic histology state that lesion contains sebum, outer root of hair follicle is pilar cyst.